So Adam, we know that it's really important that men take their health seriously, and perhaps in the past, maybe men have been reluctant to seek the advice from their GP or the health professional. What's your thoughts on that, and is it changing?
Yeah, I think it's true that men have in general been reluctant to come forward. I don't know whether it's an old-fashioned attitude to thinking that somehow going to see your doctor is a sign of weakness or something. But definitely, men do tend to come less, and I often find patients will come and see me and tell me, my wife's made me come, or if it's younger men, it's my mum's made me come.
I make my husband go all the time.
That's usually what happens. But it is very important actually that we try and change that mindset. Obviously men have as many health problems as women, and should really get them addressed as soon as possible. There are obviously specific things to men to look out for. So all men should be checking their testicles regularly to make sure there's no lumps and bumps. Older men should also be thinking about their prostate, and particularly if you do develop symptoms like difficulty passing urine, or getting up lots at night to pee, or feeling you can't empty your bladder properly. Those are all signs of a potential prostate problem, which can be easily addressed by your GP. I think with regards to prostate, there maybe is a little bit of a change. I don't know whether King Charles has been, the motivating factor, or whether the TV campaigns about getting tested. But I'm certainly seeing a lot more men coming forward for the PSA blood test, which
Excellent.
it's good. I mean, so the NHS advise basically any man over 50 can ask for their PSA blood test.
Yes.
It's a good blood test. It's like any blood test, it's not perfect. But if you have no symptoms of prostate problems and a normal PSA, that's very reassuring that there's no worry about prostate cancer.
So would you recommend that every man over the age of 50 goes and has a test regardless of whether or not they've got symptoms?
Well, so it's a bit of a grey area.
It is a grey area.
It is a grey area. Yeah, I have to be careful.
That's why I asked the question.
Yeah. So there is no universal screening program basically for prostate.
Which is a shame.
Well, I think it's maybe it will come, but unlike say for cervical cancer or for breast cancer, where there are universal screening programs, there isn't one for prostate. But what the current advice is in the UK is if you're a man over 50 and you want to be checked, you can ask for the PSA blood test. I would caveat that you do get sometimes what's called a false negative with a PSA, which means a normal blood test, even though there might be prostate cancer. So any man that has prostate symptoms should still see a doctor.
Should definitely see a doctor.
Even if their PSA blood test is normal.
Okay.
But yeah.
And what other health risks do men need to be thinking about, especially as they get older?
Yeah, so I think the other big thing that men are at higher risk of is cardiovascular disease. So that's heart attacks and strokes and other associated conditions. The way to address that really is identifying the risks early. One big risk is smoking, which is obviously not difficult to identify. So all men and women should stop smoking. Other risk factors for cardiovascular disease are high blood pressure. So you should have your blood pressure checked, particularly once you're in that age of sort of over 40, over 50, you should be getting a blood pressure check. And then there are blood tests to look at things like cholesterol levels and your diabetes risk, whether you might be pre-diabetic or even diabetic without knowing it. Addressing all of those things together will reduce the risk of heart attacks and strokes and other cardiovascular disease, which is still a big killer of men. Yeah,
absolutely. And how often do you think men should consider monitoring their health?
Well, in some ways it depends on the man and what the initial checks find. So there is advice at the moment really that have a health check from the age of 40, where really you would particularly look at your blood sugar levels, cholesterol levels, whether you're overweight, and your blood pressure. From that point, normally they suggest every 5 years for someone who is healthy, but obviously if you pick up a problem, you'll want to be checked more regularly than that. So if you're found, for example, to have pre-diabetes, you should really be having an annual blood test to make sure you haven't gone on to get diabetes, and your cholesterol levels should be checked periodically to see how you are responding to either lifestyle changes or medication.
And what blood tests can we offer at one-day tests to help monitor men's health?
Well, sort of all of the ones we've mentioned really. So there are cholesterol checking and other. We do a wide range of sort of lipid checks. Some which are not available on the NHS that can help give sort of more refined risk strategy. We check blood sugar and a blood test called the HbA1c, which is a longer term measure of blood sugar. And then there are other tests that are worth doing to check your health, which are things like kidney function, because the kidneys can start to work less efficiently as you get older, and particularly if you've got other risks for cardiovascular disease, or liver function, because people with an unhealthy lifestyle can often develop something called fatty liver disease, which they will be unaware of because it doesn't usually cause symptoms, but is sort of gradually causing damage in the background.
Okay.